Hi, my name's Jessica Montoya. I'm the orthopedic technician here at the Small Animal Department at the University of Tennessee, and I'm going to talk to you today about hygromas. We often see these hygromas or over bony prominences in large and giant breed dogs, and we see these quite often in soft tissue and orthopedics here at the university, but it's something that owners may see at home. They sometimes can look ulcerated or non-ulcerated. Sometimes they can open up, have massive wounds over these bony prominences. And today I'm going to show you some things that you can pick up at your local hardware store or at your pool store if you have a pool location nearby that you can pick up and use at home in order to take some of that pressure, relieve that pressure off of those bony prominences. So we will go over some items that you can pick up locally at your stores to address those ulcerated or non-ulcerated hygromas today. They are very painful, especially when they become ulcerated and they open up. Sometimes they get so bad that they will actually rupture the tendons over the elbows. Those are the most severe cases. The non-ulcerated ones, they are a little uncomfortable, and that's why the dogs tend to switch positions quite frequently, I should say. They're kind of like bed sores in a way, and it's just because they get uncomfortable. It's a bony prominence, and so the pressure alone, because there's not a lot of skin that covers bones in those prominent areas, it creates a lot of pressure there, and then the fluid bursa fills up underneath there and creates a pocket full of fluid, and then over time that will open up or may drain, or sometimes it just scars over it. If you have a dog that has a hygroma at home that's not ulcerated, which means it's not open where you can visibly see the tissue underneath the skin, it's going to kind of look like your elbow does in general on appearance. That's a non-ulcerated hygroma. You're going to measure from below the bottom point of that hygroma to the pad that comes up over the metacarpal joint. You're going to measure that distance between there, and that's the length that you're going to cut your pool noodle longitudinally. And then you're going to take a tube sock that you may have at home, or if you have a small child that has grown out of a pair of leggings at home, you can use that as well. But you're just going to cut the end of the tube sock out so you can create kind of like a sock sleeve over the patient or your pet's arm, and then you're going to put the pool noodle over that. You can pick some Velcro up. They come, you can get it on Amazon or any hardware store. You can pick up rolls of Velcro. You're going to put the abrasive part of the Velcro on the bottom part of the pool noodle, and then you're going to take another piece of Velcro that's the non-abrasive part over the top of the pool noodle, and that's just to keep it secure in place. And then as the pool noodle fatigues or flattens out, you'll want to change that pool noodle out. But the tube sock you can change out and wash as frequently as you need to. But we see them so frequently in here that I was like, there's got to be a way that, for these patients that, don't necessarily need surgery for these, that we could do this for, that's something that the owners could help the patients out at home that wouldn't be so expensive for them. And so we've actually seen probably about 10 patients come in since I started doing this, that it actually works out really great.